Okay, I'm back. Reliving these videos and what happened, it's kind of tough, but it's also therapeutic. I'm trying to get my words out, again, to hope to, I can't say inspire people, but just let people know that are dealing with the same thing, that they're not alone. And there's other people out here, maybe going through the same thing as you, or, so bear with me, and thanks for tuning in again to listen to my journey in regards to this. So, as I was saying, it's now time for the second surgery. It's now July. I think July 2nd. I know it's somewhere around 4th of July. I might even put some pictures in. From this second surgery, because I took pictures a little bit and stuff from the first surgery, but I didn't want to post anything because I just was, again, like in shock and kind of like scared, but I wanted to have something for myself to, kind of document what I went through. So I didn't do that too much on the first one, but on the second one I did. So I'll probably be, popping up a picture here and there or something. I'll be able to show you a little bit of that journey. The second surgery, now, as I said before, I was going to tell everybody, tell my family, tell, people, so that way if people wanted to be there for me, then they would. And because a lot of people from the first surgery were like, we didn't know, you didn't tell us, and yeah, my bad, but it's all about communication, right? You keep in touch with people, you check on your strong friends, and then you kind of know like what's going on in their life from time to time. And it's okay, life happens, I understand, I forgive, I forgave, with anything. I have no ill in my heart for anyone, or it's just all love. I'm grateful, first of all, to even be here to share my story. So, second surgery was on July 2nd. Yeah, July 2nd. Go in, we prep, same thing. The doctor says, he can go in, he might be able to get like the rest out, trusting in him, right? And so we go in. The surgery, I think, is supposed to be like around 3 to 5 hours, or did they say it was going to be like 3 to 4? They weren't sure. So meanwhile, I go in for the surgery, say the prayers and all that with the family, and then when I come out, this time I'm in ICU. Like, what's going on? So I go in. I was told, I guess, the surgery ran a little longer this time than it should. The doctor was, hopeful. He was like, I was able to get out, a lot more. He did tell me that depending on what happened, like he might have to take some fat or skin or something from somewhere to like seal it, because if the tumor is like this and they had to chip at it, they chip, and then the second time it ended up being kind of like this. So it's like he went in, got the middle, and then the sides are there, and they couldn't leave it open right here. So they had to get some fat. Is it fat? Some of my skin anyway, I had to get a little incision on my stomach, and they put it inside, put the fat inside to kind of like, hold it together because they couldn't just leave it open. So anyway, so that had to be done. So not only was that done, and now, okay, I just went through the second brain surgery, and I got a incision on my stomach now from where they took the fat, and I guess they had to put what is it called? The line? I don't know. This PIC, I think it's called PIC. You know those things that they put on you when you get anesthesia? And then, not anesthesia, when they connect the IV and they have to connect the needle and it stays on your arm. If you've ever been in a hospital or in surgery or hooked up or whatever like that, you'll know what I'm talking about. But usually they put it like here on your hand, right? Or here somewhere, right? So they can find the vein. And apparently they had it down like by my ankle. I don't know. All I know is it was hurting. This second surgery was painful. People said, "Oh, you're gonna be strong. You know what to expect. Now you know what to expect. You'll be fine. You got this." And they're saying all this not knowing the emotional roller coaster that I was on between the first one and the second one, and through getting married, and the depression, and all of that. So I'm still smiling, okay, they think I got it. All right, I may have it, but this second one, it was painful. It was, if I thought I was on an emotional roller coaster, the first one, the second one now was a whole nother ball game. I was in ICU for 7 days. 7 days. This surgery is supposed to be, you go in for surgery, you stay overnight, you're there at least 1 day, and then you go home and you continue to recover. I was in ICU for 7 days. I had high blood pressure. They had to bring my blood pressure down because of the pain. If you have high pain, it causes your blood pressure to go up. I've never had any high blood pressure in my life. Until that second surgery, that's what happened. And I'm like, I'm not taking medication because I don't take aspirin, I don't take pills, any of that stuff. And the doctor had to come in and say, hey, you need to take this medication for the pain, because if you don't, you are at risk for like either having a stroke or something like that. Like, he said. So, per the doctor's orders, I took the medication. My blood pressure was brought down and never went back up after that. But they, I guess, had to give me that to bring the blood pressure down so that nothing else like traumatic would happen. So, with that, that was going on. Now it's time for me to get up and go walk. I couldn't get up. They had to come in. They had to bring a physical therapist. They had to get me a physical therapist. And this time, I had to learn to walk again. I had to walk with the walker, right? It was so bad that my entire left side was numb and weak from my arm down to my leg. So like, we have full, range of motions with our arms and stuff like that. My left side was not like that. So they scheduled me with a physical therapist, not only while I was in ICU, but when I got home. I had to get a physical therapist to get my strength back. So I'm going, physical therapist, me not being strong, like, imagine what this is doing to me. Like, I'm feeling like, at the time, I'm feeling like, wow, what's going on? and the physical therapist came on. I'll probably insert a little video as well. I had to use ankle weights. I had to use like 2-pound weights, and I wasn't even able to lift that. So imagine if you have weights, if you know what a 2-pound weight feels like, imagine that, and you're not able to even lift it up. That's how weak my left side was. So we had to get that back. So now I'm now recovering from this. This is the second time. Hold on, there's people like walking by. Okay. So the therapist came to the house a few times, gave me some exercises that I had to do. Again, I had the same restrictions, no drinking through a straw, no tilting your head down, no bending over, no tying your shoes. Like, you have to do all that again for like the next 2 weeks before when you see the doctor, and then they clear you to be able to do anything else. And I don't know if there's anybody else out there that has had this surgery. If you have, please let me know in the comments, like what happened. I want to know, did other people just have the surgery the one day and then go home? Or did they have experiences like me where they went in and then had to stay like extra days, Am I a one-off? Are there other, I just don't know. So, punchline. The surgery is on July 2nd, which means, and I told you I was in ICU for 7 days, right? I had to spend 4th of July in the hospital. Not that I celebrated or anything, but I had a window view. So again, my surgery was again in Kaiser Sunset. So most of you know that's like a Hollywood area of Los Angeles. But where my room was, I had a view of downtown LA. And yeah, so I was able to watch the fireworks. But if anybody knows or can remember, in 2019 there was an earthquake. So not only did I just have brain surgery, I was in the hospital for 4th of July, but there was an earthquake while I was in the hospital. Imagine that. And I'm hooked up to like all this stuff. But then I remember people saying like, okay, maybe if there is ever an earthquake, then a safe place to be would be in a hospital, right? So I just sat up in the bed and just rolled it out, I guess, because the hospital is on rollers. So it wasn't too bad, I guess, because I was used to earthquakes, but it was bad enough for me to like sit up in the bed and be like, whoa, what's going on? So with that being said, the earthquake happened. When the earthquakes happen in the hospital, all the fire doors close. They close, everything goes, no elevators, nothing. You can only go by stairs. They get everybody out that's on the ground floor, like safe and all that stuff. And I had family downstairs coming to visit, and they weren't able to get back up to the room to me for a little while. So I'm now here just having brain surgery in the room alone. My family's trying to get up to me. Just so happens at that particular time when the earthquake happened. So that was kind of like a little highlight of the second surgery. So after the 7 days, I go home, go through the same thing of recuperating, can't work out, bed rest, until the doctor clears me. So now, after that, they're telling me that in 6 months, we will do the MRI again and we'll monitor it. So I go for the checkup in 6 months, and then he monitors it. He's like, okay, it doesn't look like it's growing. So in 6 months, we'll continue to monitor you every 6 months. And this is now still 2019. So I'm continually to get the checkups, the MRIs, and, slowly easing my way back into working out and just kind of living like a normal life, if you will, again. And yeah, that's been my journey with the first and the second surgeries. So within a 5 to 6 month span, I had 2 pituitary adenoma surgeries. Adenoma is tumor. 2, I had, within 5 months, I had 2 pituitary adenoma. Yeah, brain surgeries, basically. How would you feel if that were you? How would you feel? So, I know that I said piercings and tattoos were my vice at that time to cope with depression, and now, second surgery is over, what am I doing? Back getting more piercings, more tattoos. But this time I just didn't go so far with it. I decided to start journaling. Anytime I was feeling sad or lonely or depressed, I would just pull out my journal and write down my feelings so that later I can always go back, and look at it. My hopes at that time was I was going to try and vlog on my YouTube and share it with people in that moment, but I don't know. I don't know if it wasn't my time, or maybe I would have met people that has gone through the same thing, I really don't know. But what I do know is it is now 2024. So 5 years later, January 19th, 4 years later, 5 years later, and I am now preparing for my 3rd surgery. Yeah, I now have to prepare for a 3rd surgery. And after that 2nd surgery, my previous surgeon told me that they wouldn't be able to go in again through my nose. They would have to, give me craniotomy, go through my skull. But I recently had a consultation with a surgeon out here where I am currently, and that won't be the case. And I will try my best to vlog in real time as I can. In regards to the 3rd surgery, I feel that I'm much stronger now in speaking about it, because in the headspace and stuff that I was then, and even up leading until now, totally different. My spiritual is aligned, my faith is much stronger, and I know that I'm being brought here for this 3rd surgery for a reason. And the Most High, Father God, is going to be right by my side, along with my husband. Is going to be right by my side, and I can say that I will get through this. I don't know what the physical outcome will be, but mentally I'm prepared this time around. So thank you for listening to me speak about my journey. If you know someone that is going through this or that has it, I pray for them, and just we will get through this. So I'll try to vlog in more real time. And when it comes to this 3rd surgery, I think it's time for me, for that release, that outlet, to be able to, reach others and give them a little bit of hope, right? A great saying that I was once told was, where there's a smile, there's hope, and where there's there's hope, there's faith. Thank you for watching. I appreciate you. I love you, and I will see you all in the next vlog, my teacups. Bye.